Kemlyn Nemard is with us this morning, Executive Director at the Women's Health Clinic in Winnipeg. Kemlyn, welcome to our program. Happy to have you with us today.
Good morning, Heather. Happy to be here.
Thank you. It's an important discussion. I'm wondering, first of all, what has the discussion, what has the reaction been in your clinic since these leaked reports saying that the overturning of Roe v. Wade appears imminent in the States?
Well, I think there's shock, frustration, anger. It's crazy that we're in the 21st century and we're still having this debate. That's, I think, one of the overwhelming feelings. As well, just, to me, it again shows that women aren't considered equal, right? That in this day and age, they're suggesting that women don't have sovereignty over our bodies. And, that we are still slaves to regressive and oppressive laws, and people outside of ourselves. So, I think that's probably the first reaction that we've had.
And I'm wondering, subsequent to that, if there's been any preparation. I'm wondering, you already, I know, at the clinic there provide abortion services to those who are out of province, including people from the United States. What do you think might happen in terms of demand should this be overturned?
Yeah, that's a really difficult question because we don't know, right? We don't know what's going to happen. We don't know yet, and we don't know what that demand is going to be.
Are you actively preparing, though, for a potential increase?
Well, there's no way for us to do that at this point, right? Like, we actually get funded for a limited amount, providing a limited amount of abortions. Every year, we actually provide more abortions, about a quarter to a third more than we get funded for. So there's already, at this stage, there's already more demand than we actually get funded for. So there's already pressure on the system.
Can I just pause? I want to talk about the funding point in a second. What percentage of the services you provide would be for people coming in from the States presently?
We actually don't track that, so I couldn't give you that number.
Okay. On the funding question, though, I know that some of your funding is set aside and, in fact, is money raised to pay for people's travel so they can access the services which you provide there in Winnipeg. Do you think if there were more people wanting to come in from the United States, if this should happen, what would that do to your funding? And would it mean perhaps that Canadians are deprived of that money for travel and access as a consequence?
Yeah, that's not okay. First of all, we don't get funded to support that. That is simply fundraising. That we have a fund that we fundraise to help support people that can't afford it, if they're from out of province, or if they need help around travel costs and things like that. And it's, first come, first served, right? So it's not a huge fund, and it's just what we raise through fundraising. I think the second thing is we don't, we're all about access. So we're not about turning people away. We don't, there's not a grade of people sort of that we have and say, well, you don't quite fit this category, so we're not going to see you. I think it's more important to look at what access is like, generally speaking. Clearly there's a problem with access regardless of this, right? If you live in Manitoba, for instance, and you are in the north or you're in a rural area, access is not equal. And that is the same across the country. If, in Nunavut, you actually have to leave the territory to get access to abortion care. In other provinces, you can only, like New Brunswick, for instance, all of their community clinics have closed. You can only get access to an abortion through the hospital, and I think it's only certain days of the week. So I think we actually need to broaden that conversation, right, and look at access itself is an issue, and that needs to be addressed in our country regardless. I think the other thing we need to talk about is, we're a country the 10th the size of the United States. There's no way that we could meet the demand in this country for how many abortions there would be if everybody that needed an abortion came up from the South, which doesn't mean that we wouldn't support people and provide abortion care to people that are looking for it from the United States. But I think it raises a broader question. And part of it is that in south of the border, people need to demand from their legislatures that they actually enact laws that meet the needs of their entire population.
Okay.
And I think it's the same here, right? We will obviously stand toe to toe and shoulder to shoulder with them in that fight, but I think we also need to maintain that fight here in Canada too. And I think it's important for us not to lose that perspective.
So when you hear, for example, as you did yesterday, I'm not sure if you heard this exact comment, why don't we pause and play the tape? The Prime Minister again reiterating his pledge to protect abortion rights in Canada. Here's what he said, and Kemlyn will come back just after this.
We can make sure that all women have full access to the full slate of reproductive services wherever they live in this country. And I also tasked our Minister of Health and a Minister of Women and Gender Equality, Ministers Duclos and Ian, in their mandate letters, to look at the legal framework that exists around reproductive health and services like abortion, to ensure that we move forward as necessary on ensuring that not just under this government, but under any future government, the rights of women are properly protected.
So when you hear that, again, looking to the Canada Health Act to ensure for the future, sounds like codify. What do you think in terms of hearing the Prime Minister on that point, and was there any reassurance in that for you?
Certainly there is reassurance when, the Prime Minister is saying that. I think what I would really like to see, though, is that in action, right? That there is actually action happening for more funding to support true access across the country, no matter where you are. Abortion care provision you should be able to access it as close to home as possible. You shouldn't have to get on a plane and rent a hotel room and have to take days off work to get access to abortion care, right? That in itself means that there are a whole number of people that don't have access because they cannot afford it. I think it's a multi-layered sort of issue. Things like there are not enough abortion providers. That's part of the problem. Particularly when you look at medication abortion, that can be done by a primary care physician in their office. So why is it that there are so few abortion providers in the country? Because that could in itself would bring access much closer to home. Right? So there are so many different facets.
Yes.
And, one of the things I would hope is that in looking at that, the Prime Minister and the Minister of Health would reach out to agencies such as us, like providers, as well as reproductive right activists, and say, okay, what do we need? What does that look like? And how can we make sure that we have not only maintain our current system, but actually enhance the system that we have?
Well, the whole issue is, again, being examined, re-examined in light of what is happening now judicially in the United States. To wrap up, and I hope this isn't our final conversation on this point, Kemlyn, but based on what's happening right now in the U.S., are you seeing any erosion in rights right now in Canada, and how concerned are you? What is your level of concern that Canada could be drawn down the same road in the near future?
So, our legislative framework is really different than the United States. So from that perspective, I hope it would be more difficult to have such a sweeping mandate like it is in the States. But having said that, I think that we need to guard against that sort of rhetoric, right? Because we hear it, we've heard it, certainly I think in the last 5 to 10 years, that rhetoric has been amped up. Since that rhetoric has really amped up in the States, and we can't be naive to that impact. And I think that as reproductive rights activists and providers, we need to, and just the general public, we need to put our foot to the gas and not not let up on this and not assume that something like that cannot happen here. And we need to demand from our federal and provincial MLAs and MPs and MPPs that not only do they maintain the system, that they put things in place to enhance access. So funding more, having more places, having more providers, making access a lot easier for people that need that care.